Good afternoon, everybody. Today I want to begin with the good news, the approval of the Oxford AstraZeneca vaccine, which is a fantastic achievement for British science and which will allow us to vaccinate more people and also vaccinate them more quickly. And there's one important development that's helping us to accelerate our vaccination programme across the whole of the UK. We've had new advice from the Joint Committee on Vaccination and Immunisation that the first dose can protect people against the worst effects of this virus because the benefits kick in after 2 or 3 weeks. And so from now on, we will give a first dose to as many vulnerable people as possible, with the second dose to follow 12 weeks later. And what that means is we can vaccinate and protect many more people in the coming weeks. I know that everyone watching this will want to know when you can get your vaccine. And all I want to say is that we are working as hard and as fast as we can to get the supplies to you. And as soon as we have the supplies, we'll be getting them into people's arms. To summarise where we are, we have to face the fact that we've got two big things happening at once in our fight against COVID. One's working for us and one working against us. On the plus side, we've got two valid vaccines and we're racing, as I say, to get them out. On the downside, there is a new strain of the virus which is spreading much faster and surging across the country. And we've seen a 40% increase in cases in England in the last week alone, almost 15% more patients in hospital, more than at the peak of the first wave. And yesterday, sadly, we recorded almost 1,000 deaths across the UK for the first time since April. So at this critical moment, with the prospect of freedom within reach, we've got to redouble our efforts to contain the virus. And that's why the Health Secretary has announced that more areas of England will be moving into Tier 4 from tomorrow. And I say again, no one regrets these measures more bitterly than I do, but we must take firm action now. And that's why we have to think very hard about schools, because today, of course, it remains the case that keeping children in education is a national priority, and it remains the case that schools are safe. But we must face the reality that the sheer pace of the spread of this new variant requires us now to take even tougher action in some areas, and that does affect schools, and let me set out for you what this means. In most of England, primary schools will still reassemble next week as planned for the new term. But in the areas we've just published today on gov.uk, I'm afraid the start of the new term will be delayed until at least January the 18th, when the latest data on those infection rates will be reviewed. And that is because the rate of transmission in these areas is so high, and there's just such pressure on the local NHS that extra action is required to control the spread of the virus. The children of key workers, or those who are considered to be vulnerable, will still go back to primary schools from next week, wherever they live in England. And they are not affected by today's announcement. In secondary schools, all vulnerable children and the children of critical workers will go back next week across England as originally planned. But we will ask exam year pupils in secondary schools to learn remotely during the first week of term and return to the classroom from 11th of January. The remaining secondary school pupils, i.e. non-exam groups, will go back a week later. That is from the 18th of January. But I want to stress that depending on the spread of the disease, it may be necessary to take further action in their cases as well, in, as I say, the worst affected areas. To minimise disruption in schools and to fight the disease, we're massively expanding our testing operation, ensuring that every secondary school pupil is tested as they return and regularly thereafter. I, again, want to thank teachers, pupils, parents who've worked so hard to keep schools safe and keep them open. We're also asking universities to reduce the number of students who return to campus in January, prioritising medical courses and others requiring face-to-face teaching. And in all cases, students should be offered 2 rapid tests when they return. All of these measures are in the end designed to save lives and to protect the NHS. And for that very reason, I must ask you to follow the rules where you live tomorrow night and see in the new year safely at home. That means not meeting up with friends or family indoors unless they're in the same household or support bubble, and avoiding large gatherings of any kind. We are still in the tunnel of this pandemic. The light, however, is not merely visible. Thanks to an extraordinary feat of British engineering, if you like, the tunnel has been shortened, or we're moving faster through it. And that gives me great confidence about the future in the spring. So, for now, let's redouble our efforts. Let's follow the rules, protect our NHS, and together make 2021 a year in which we leave this tunnel behind us.